Hi, my name is Kevin Noel. This is going to be for the intramuscular injection video. So the first thing that we would do is we would gather the required materials. In this particular case, we're going to need alcohol swabs and gauze, our morphine, and we're going to need our needle here. So typically for an intramuscular injection, we're looking at, so optimally you want to use ventral gluteal site, so the buttocks, or the vastus lateralis, which is the thigh. So in this case, we're going to be using in this example, we're going to be using ventral gluteal because the amount of medication that's being ordered is 1.5 milliliters. And the only 1.5 milliliter needle that I have requires a 1-inch needle, which would be the ventral gluteal or vastus lateralis, what you could also do in the leg as well. So, so the first thing we want to do is gather all the materials. That was it. We're going to verify the 6 rights of medication. So right patient, right drug, right dose, right time, right administration, and right route of administration and documentation. So we want to verify that we have all of those. We've got the right order. We've got morphine. The morphine is, we'll go over that in a second. So I'll introduce myself. My name is Kevin. I'm going to be your nurse today. And then we're going to want to provide patient privacy. So we're going to go ahead and close the curtain, verify the patient with at least 2 identifiers. So we're going to double check the patient's wristband and make sure that we got their name and their date of birth or their barcode or anything like that. We want to ask the patient if they have any allergies. So we want to go over any food, medication, seasonal, or any other allergies that they might have. We're going to inform the patient of the visit. So we're here to give you a morphine injection for pain. It's morphine is going to be used again. It's for pain. It's pain control. It's a narcotic substance. So we're going to be administering this to help with pain. Some common side effects. So you can get some nausea. There can be burning or redness or allergic reactions possible as well. We're going to want to let the patient know that when we're administering it, there might be a slight burning or stinging sensation when we're administering it. And then let them know that if there were any adverse reactions that are to occur that I just listed off, to make sure that they let me know immediately. We're going to want to ask the patient if they have any questions at that point. Assuming that they don't, we're going to go ahead and perform hand hygiene. So we want to go ahead and wash our hands, make sure that we're doing a really good job of washing our hands and getting everything. And then we're going to want to put on some clean gloves. All right. Some clean gloves on. All right. And then we're going to want to draw up our medication. So the first thing we're going to want to do is make sure that we have the right needle and everything. Like I said, the right needle is in this case, going to be a 1-inch needle, and it's going to be 25, or I think it's a 25 gauge. You can use a 25 gauge. This is a 25 gauge needle, yeah, which is fine. Whenever you're doing intramuscular, you want to use anything from a 20 to a 25 gauge is pretty typical. If it's an oil-based solution, you want to do a 18 to 21 gauge, so which is a bigger needle. Smaller the number, bigger the needle. We're going to go ahead and clean off our vial with an alcohol swab. What that does is it cleans it off, so when the needle touches it, you don't have any infectious materials touching it. So we're going to go ahead and do that, and then we're going to fill the syringe with the medication. So we're going to go ahead and take off this safety here, and we're going to want to fill this to 1.5. So again, the way that this works, the way that it works is it's let me see, the medication is I think it's 4 milligrams per milliliter. We have a 6 milligram order, so that would be 1.5 milliliters is how much we want to distribute. So you want to fill the air into the vial. So we're going to put it at 1.5. You want to make sure that the line right there, let me try and see if I can get it right there, is on the 1.5 mark. And then what we're going to do is we're going to go ahead and inject that air into the vial, and then we're going to go ahead and withdraw 1.5 milliliters of the liquid here. Okay. All right, so that is 1.5 on there. I don't know if you can see the numbers, but it's 1.5 milliliters on there. We're going to want to remove any air bubbles from the syringe, anything like that, just to make sure that we don't have any problems or anything going in. Air bubbles in your veins can be bad. We're going to want to so whenever you're doing an intramuscular injection in the butt or in the gluteus, you want to assess for any bruising, skin irritation, edema, anything like that, and any problems. You want to palpate the skin and make sure that there are no problems on there as well. I'm going to be using this box thing. We always want to use the ventrogluteal side if possible. It's the best place to give it. There's a lot of blood vessels and stuff down there. We want to avoid any areas where there be any problems. So I'm going to go ahead and bring this down so you guys can see my injection site. With the ventrogluteal site we have right here, we're going to go ahead and clean it with an alcohol swipe. And we're going to wipe at the site of the injection and then go out in a circular motion about 2 inches. All right. And then we're going to let it dry on its own. Drying on its own, we don't want to blow on it. We don't want to touch it. We definitely don't want to touch it. We don't want to hit our hands with it or anything. It can give it germs. It kind of defeats the purpose. Intramuscular is where you use the Z track, which is where you'd actually use your hand to kind of stretch out the site, and then you would give the injection and let it go, and that would actually hold it in. But for this, we're going to be using our thumb and forefinger because that's what the video calls for. In this case, we're going to go ahead and hold between thumb and forefinger, and we want to go ahead and give a nice swift motion and get in there. For the non-dominant hand, I'm going to go ahead and get the skin tight, and then we're going to go ahead and inject it. So we want to be at a 90-degree angle with this, and we're going to go ahead and inject this in. I think that I don't want to put the liquid in there, but anyway, so we would inject the medication in. I had a feeling it was going to go through the box, and I don't want to get the box all super wet. So we would inject it. We want to inject it nice and slow. While we're in there, we want to leave about 10 seconds. You want to leave it just to make sure that everything goes in there. Now, after the injection, we would want to hold the needle and make sure that the needle is stable. Before the injection goes in, we want to pull the plunger back about 5 to 10. We want to make sure 5 to 10 seconds. Sorry. We want to make sure that no blood appears. So basically, if blood appears, that's bad. We would need to pull it out and then re-inject. Once the medication is injected into the body, we want to wait about 10 seconds, and then we will slowly withdraw the needle, release the skin, and then we would place a gauze or an alcohol swab over the site, and we do not want to massage it. After that, we would go ahead and we would not recap the needle. What we would do is we would throw it in the sharps container, which is a red container that is off to the side. I just recapped it right now, so then I don't hurt myself with it. But then we would want to remove our gloves over each other like so. And we would want to perform hand hygiene, and then we would be documenting. So when we document, we want to do the right patient, we want to do the right dose administration, and we want to put everything in there. That way there's no double dosing or anything like that. Thank you.